Welcome, everybody. This is Netta Pitt. I'm the host of the CISO's Current, a CISO's Connect podcast. Hi, everybody. Thank you for joining us at another episode of CISO's Current, the podcast where we dive into the new view of what a CISO is and how they are driving business transformation and are becoming a business enabler for the organization. I'm thrilled to have on the show today Erik Decker, the Chief Information Security Officer at Intermountain Health. Intermountain Health is a leader in advancing patient-centered care through secure digital ecosystem. They have a lot of influence. Erik has a lot of influence over the healthcare security policy. Erik brings unparalleled experience in protecting sensitive health systems and enabling clinical innovation. That's super important. Obviously, everybody's worried about, their information, especially when it comes to health. So thank you for doing what you do, Erik. Today's theme is going to be, we're going to talk about protecting healthcare at the speed of care. Right. And that's a particularly hard nut to crack. All of us CISOs, we have a pace at which we work. I don't know that we work at the same pace as healthcare. Right. There is a difference when people's need to have systems up and ready for life-saving procedures. And so there's a different element, and we're going to go and talk through that today. But let me turn it over to Erik, and you can, jump in and welcome you to the show. And, I'm going to turn it over to you.
Thank you. It's funny you say working at the pace of care. And I think if you would go pool some patients these days, they would say healthcare is slow. That's not the pace we want to operate at.
I think it depends on which side of the equation you're on, right?
If you're very true,
then you want it done now, right? Yeah. No, I get it.
But for sure, like if you're in a trauma center, you want that to be going at a clip that you're expecting it to be going. So very, very astute. Thanks for having me on the podcast. So I just quick little introduction on myself. So CISO for Intermountain Health. You mentioned sort of who we are. We're an integrated delivery network that's located in the Mountain West region of the United States. So an integrated delivery network means that we have both the care side of the equation as well as the payment side of the equation. So we have both the health plan and the delivery of care. 34 hospitals, 6 states, $17 billion organization, 70,000 employees, and 1 million lives on our health plan. So big, complex organization, do a lot of innovation at Intermountain. We spin up a lot of different types of companies or invest in different types of companies and really try to break the model on how we deliver care. So we're fully in on the value-based care models in healthcare. And what that means is rather than the old fee-for-service models of healthcare, where you go to a doctor, there's a fee ascribed to that encounter, and you pay the doctor for that. And then, those kinds of fee-for-service models get you into very costly, very complex care models and very expensive care. We're in the realm of, well, we do all of that, of course, but we want people to live the healthiest lives possible that they possibly can. And the way we're reimbursed by that is not percent, but a large portion of our reimbursement are actually populations of care to the populations of patients that we have and keeping them well. So we actually make our money when people are well. That's kind of the model, which is very cool. I also served as you'd mentioned the sort of critical infrastructure component. I know we'll talk about it a little bit more, but the national healthcare, national security side of all of this. So for the last 10 years, I actually just rolled off as chairman last year. I was the chair of the Health Sector Coordinating Council Cybersecurity Working Group, which is where healthcare comes, we're one of 16 critical infrastructure healthcare is, and this is where we come together with the federal government to tackle these national public safety, patient safety, public health issues, moving beyond just the organizations themselves and into what do we need to do as a whole system, a whole healthcare system for our country in order to, be able to provide and care for people. That is our primary mission, and that's what we're here to do. So it's been very awesome. It's all pro bono, all voluntary work, but incredibly passionate about it. We've done a lot there. So hopefully we'll dig into that a little bit.
Yeah, I mean, I think that's that's the trend that I see of CISOs. Um, we I think maybe there's some specific personality traits that we hold as
Sure.
being a CISO, but we love this job. It is a super hard job, and after you've kind of gone through the litany of how many people you're managing and what you guys are really trying to do and how you're flipping the model, which I love to see from a person on the patient side. I love to see that,
Sure.
right? But we love our roles, and we love the community, the CISO community, and cybersecurity as a whole. And we, like you were saying, it's a bunch of pro bono work and things that you do. We all love to give back to the organization and to the cyber community. So thank you for everything that you're doing that way and that you have done. So that's awesome. But I think that's a trend in our profession. Everybody is looking to help everybody else. It's a team sport,
Yeah.
as I say.
I wonder if there's a PhD study in there somewhere. Like what is it?
Probably. What makes a CISO tick? Yes, I think that. I don't know that everybody would sign up for it. That's a CISO. Maybe we don't want to know.
That's true.
So, when you're talking about how you're changing, you know, you're working to help change the model, and you're working to help change, and deliver that care at pace, right?
Mhm.
Again, depending on what side of the equation you're on, that could be slower than expected. But
Mhm.
in general, you guys are trying to deliver at pace a very secure, very effective healthcare system. And so, with that said, how do you go about building in that resiliency,
Mhm.
building in how that directly impacts patient safety, how because those are the intricacies that I think in the healthcare realm. If somebody can't buy boots, right, at a retail store, okay, that's a problem. But if somebody can't get a scan that they need, that's a much bigger problem. And so that resiliency and that dedication to how that impacts the patient, can you explain how you kind of work through that?
Yeah. So I think first of all, there's a level setting. I think that needs to be done. So and maybe this is a product of being in a life safety industry, and I've been in this industry for a long time, so it's just sort of natural for me to think this way. I'm not sure everybody naturally thinks this way. So our profession, um, it started off. I mean, just think about how we called cybersecurity at the beginning. We called it data security, information assurance, information security. It sort of changed its names over time, but it always started with data, and it always started, if you remember, for 20, 25, 30 years, confidentiality and privacy of data. Like that was our main charge. Well, about 10, 15 years ago, that changed. And what changed? Well, what changed was the reliance on digital technologies and the digital ecosystem. That's what changed. And so, yeah, okay. Now, if we want to get, debatey about it, you could say, well, we're still protecting the data because it's about data availability, and the data availability that comes out of the systems, and it's got to be there. And da, da, da. Okay, like we can debate, terminology, but
Right.
keep it simple, right? Is the easiest way to think about it. So first and foremost, we're beyond data security as a profession. And it's time for everybody to understand that. And because what we're actually now about is business enablement and business resilience. And what does that mean? Well, all of our companies are reliant on this tech stack that has scaled to allow for us to operate at a clip and with more volume, more capacity, more transactions, more. Well, that was all technology enabled. We've become so overly reliant on that. When that has hiccups and disruptions, it has cascading effects. Now, not only does it have cascading effects inside your company, it can have cascading effects around you. So let me talk about this from a healthcare specific context. So 2008 was the American Recoveries and Responsibility Act, which is where we introduced a major stimulus to get people off of paper charting and into electronic record charting. Okay, so that started the ball rolling. We got moved into EMRs or EHRs, electronic health records, whatever you want to call it. That became the place where we document. That became the place where we do our bill collection, our clinical notes, our clinical protocols, our clinical decision support. All the things that we do to care for people is now technology enabled and prompted. It took 10 years, about 10 years, for that to become a thing that people were like, oh man, I don't know if I like this new thing, to I don't even know how to paper chart anymore. So like new doctors, new nurses coming out of school, they're not trained on how to do this outside of technology. So now what you have is the patient safety aspect of the technology being unavailable and how that can relate directly to the care for the individual. Now, it's not all patients are equal in this setting. You got to think about it on the different types of acuity of sickness that they have. Some of this is the timeliness of the care matters. So when I look at this, first and foremost, when I think about resilience, I'm thinking about what is the highest acute care that we need to be available for, and what are our vulnerable patient populations, where again the timeliness of the care matters. This is where the PACE part of that conversation comes into play. So the classic case, of course, is your emergency department, your trauma centers. If you experience a trauma, you need to get into a hospital and you need to be cared for immediately. If you have a stroke, the difference between a life-saving intervention and a non-life-saving intervention is a radiological imaging picture of your brain that says, is it a bleed or is it a clot that's causing the stroke? That tells the doctor, do I put a clot blister in or do I put a clotter in? Because if you have a bleed, you need a clot. Right. If you give the wrong intervention, the patient's dead. So that's the difference now, and that's reliant on a technology, which is a CT scanner that's in these trauma centers that needs to be available and operational when the time comes. So I don't think I do, don't get me wrong. Of course, I care about the data security side of this, the confidentiality and privacy. I very much care about that. Priority one is people's lives. Mm-hmm. And so it's, so I know that my ED departments, my trauma centers are incredibly important to be up and operational. We have, of course, means in hospitals. You can't operate a hospital without having an incident command system in place that can account for what happens when something goes awry. There's things called diversion and stuff like that, where we send patients off to other hospitals. But I'll get into that in a second about why that's problematic in a cyberspace. There's also another piece, vulnerable patients. So think about patients who have very aggressive cancers or a chronic condition that needs to be treated on a reoccurring frequent basis, like dialysis, kidney failure. You got to go to a dialysis center very often in order to maintain your healthiness while you're potentially waiting for a transplant or something. Those are also important. Maybe the timeliness of that isn't as timely as the level 1 trauma, but it's important, and in that days, these things have to be managed within days. And then you can get into different things, like seeing your primary care physician. If you get bumped on that, it's annoying, but it's not, it's not going to harm you per se. Elective surgeries, you can differentiate this. So when you think about resilience and you think about digital, to me, it's a question of what are the most important clinical protocols that we have, the timeliness of those clinical protocols. And we understand the antithesis of resilience is outage. So you're out, and you're out for, when you see the ransomware attacks, you read about the stuff in the news, you're out for a month or two. That's why this is so damaging. When, hospitals can handle an outage for a day or two,
Right.
and then the scale catches up to them. The so what does resilience mean to me? It means, to answer your question after a long
It's all good. It's all good. It was great
preposition.
information. It's all great information. Because I think
It,
it's great information. The reason being is we all just show up to the hospital, or we all just show up to our, like, we expect you super smart people to have all that under control. And it sounds like you guys do. However, like,
wow.
it's a good insight as
Yeah.
to what is going on in the background, right?
Yeah.
So it's great background information.
And again, so one of the kind of the opening statements here is, what does it mean to be a CISO? This is what it means to be a CISO. Like, truly knowing what your business value is and what you're here to do, what your mission is, and how you engage and enable them. What I just described is exactly what enabling the business is. It's about making sure we are prepared in the case of, say, a ransomware attack or something like that, which on average has a 30 to 60 day outage window. Well, if we know that that's what the norm is, then that's not what we should set the marks for on response, right? We should set the remarks for days for those very critical protocols I just described, so that we're caring for people without a hiccup. That's what
Right.
even if the technology is gone, and we don't, it's, the standard way of operating is gone. If we prepare ahead of time, we can manage through it. Not that it won't be difficult, it'll be difficult, but we can manage through it without, a full shut. There's
You
an
know,
interesting, sorry, one more quick thing, and then
for
I'll,
sure.
there's an interesting study that was done by Dr. Christian DeMeth and Dr. Jeff Tolley at UCSD. That's UC San Diego. They measured the impacts, the secondary impacts of ransomware attacks on hospitals in a surrounding area in a community. And so what that means is, for a hospital that gets shut down through a ransomware attack, we understand very concretely what the damage is. But there's actually a corollary, a secondary impact on everybody around that hospital. They also felt impact. They weren't attacked. Why? Because all of those patients that were trying to be seen at that hospital diverted to other hospitals. The hospitals generally run at about 80, 90% capacity in their emergency departments, because that's like, there's a profitability aspect of this as well.
Right.
And, you can't be oversubscribed and over capacity. Well, once you reach capacity and you're over capacity, which these surrounding hospitals were, like, almost immediately after the result of that ransomware attack, wait times went up, stroke response time went up. They stopped it, saying that this caused patient safety issues, but it's very easy to see that
Right.
that's very likely possible.
That cascading effect, right?
That's right. And so we're an ecosystem. I mean, at the end of the day, the healthcare environment, the healthcare industry is connected. There are no four walls of any one organization that does all of this. We are utterly connected, and we feel the ripple effects when things start to cascade through as attacks happen and such.
Yeah, no, I mean, amazing insight, Eric. I mean, I was talking to a friend that's actually is a CISO at another healthcare on the East Coast. And
Mm-hmm.
we were talking about it's that conversation that you actually have to have with your overarching leadership team, right? Because inevitably, even in healthcare, people have a tendency to say, "Oh, well, we'll just do paper charting, right? If we have a ransomware." Okay, but then you have to pull the string, right? So where are we getting all the paper? Probably don't have enough, right? How are we getting information to do and send somebody needs blood work? Well, that's got to get to the lab, and now you don't have email.
Yep.
Like, it becomes, like we were talking about, the cascading effect. And
Yep.
so I think it's amazing in how you kind of articulated, in all of our industries, right? We have that, uh, crown jewels kind of approach. And you guys have that, but then you also have patient care on top of it, right? And so it's a true balancing act. So I really appreciate you giving that information, because I don't think everybody thinks about it. Again, like I said, we all just show up to our doctor or to
Yeah.
the urgent care or to the emergency room and say, fix me, right? And we expect it to be done.
Yeah.
So talking about that and how you guys are such an ecosystem, right? And that public-private collaboration, right,
Mhm.
within the healthcare industry. You know, I think there's, as I think in any um, of our sectors, there's good and bad to that, right?
Mhm.
However, I think I'd like to understand your perspective on what that private public collaboration looks like, and how that's actually driving to make things better, or where there's some areas where you need to close the gap, or we need to work to
Sure.
close the gap.
Yeah, so I think first of all, I mentioned 16 critical infrastructure before. So that's a federally defined um, construct. It was actually done through presidential directives. National Defense and Authorization Act kind of put it in play as well. It's not totally codified yet in law. It really needs to be. But the idea behind this is private industry is running national utilities, and you can think of healthcare as a national utility. And so in some cases it is federalized, or the states run them. But let's just talk like finance as an example.
Right.
That's one of the critical infrastructure. We all know that that's run by corporate America, banks, et
Right.
cetera. Those are private industries. But we all absolutely rely on the financial sector to be stable in order for us to survive. We need water. That's another critical infrastructure that tends to be run more by governments, local municipalities, and such. Oil and gas, private industry, transportation, a little bit of both. Um, Healthcare, of course, education. These are all things that we rely on as a society to be up and operational. So first and foremost, it's recognizing that we are not only just a corporation and a company that's doing business, but we're also directly responsible for public health and the well-being of our people. So what we've done is there's in this construct, there's every industry has an industry side of the equation, and then what's called a sector risk management agency. So it's a three-letter acronym agency on the Fed side that's responsible for the relationship. So Health and Human Services is that for healthcare, of course. And we come together in this forum where we discuss these challenges that face the totality of the ecosystem, and then we build. We provide advocacy for certain policies and things like that as necessary. I will be very clear, this is not a lobbying or
Right.
arm. Like, we're not lobbyists. We're not allowed to be that. But we are the practitioners. So here's where things lie. This is what we do. This is what we need. Here's some suggestions. We've produced in the healthcare industry. We have this thing called the Health Sector Coordinating Council Cybersecurity Working Group. There's something like 28 publications that we produced, 5 of them joint published with HHS. One of them, many of them I've been involved in. So I was the core author of the Health Industry Cybersecurity Practices, or HICCUP. We purposely named it that to be easy to say. HICCUP.
I love when people have a little bit of a sense of humor when they
Yeah, you gotta have a little HIPAA and HICCUP. There you go.
go together.
So what HICCUP calls for is the 5 threats that we all face and 10 practices to mitigate them, stratified by small, medium, or large size organizations, because the way you do cyber in a small is different than you do in a larger one. And so the cool thing about this is we produced that publication in 2018. We updated in 2023. In 2020, 2021, it was embedded in law in HIPAA and high tech, and it instructed OCR, the Office for Civil Rights, which is the regulator, to consider the adoption of HICcup during any enforcement actions. So it's a carrot in the carrot and stick kind of construct. And what that practically means is if you've done the things that the industry and the government has said will make you more resilient to these attacks, you're going to get a pass. I mean, it's not safe harbor, so I'm not a lawyer and I'm not going to tell everybody you're, guaranteed a pass, but they have to consider it. They have to consider your adoption of that as part of their enforcement, because we always say, it's not if, it's when. Okay. So it can happen. And so then it's a question of, have you done the reasonable nature of security? And so HICcup, it's not intended to be like the program, the only thing you need to do. It was actually written to, frankly, be minimums. And we were very, very, very close to getting minimums set. It didn't happen. And there's still some work being done on that front. But the next evolution of HICcup or the next addition to it was the health and public health performance goals, cybersecurity performance goals, which I also helped write. And that was it's purposely built to be the puzzle piece that's missing in deflecting ransomware style disruption attacks. Instead of data security and that kind of side, which HIPAA really covers well, it was how do we deal with all this other stuff? And if you look at the cybersecurity performance goals, you'll see that HICcup is embedded in them. It defines exactly what needs to be done, the CPG. So example, two-factor authentication on systems exposed to the internet. Notice I did not say two-factor authentication on every single system. And I also didn't say two-factor authentication on systems with PHI, because I don't care about, I mean, I do care, but I don't care about it doesn't matter about the data on where the 2FA is. What matters is the exposure, because what happens with ransomware attacks, infrastructure is compromised. The foundation of what runs all the tech is compromised. So you can't look at it from a data security perspective. You got to look at it from an infrastructure resilience perspective. And how does that happen? It's on the internet. 9 billion people can interact with it. If you only have a password, you're done. So so it's really like get clear about what needs to be done. And then HICcup, actually, it's like 250 pages HICcup is. So there's a lot of how inside of it. How do you actually implement two-factor authentication as an example? So anyways, that's some of two examples of what this construct has built and how it's actually been embedded inside the regulatory regime. You're muted, Nita.
Yeah, so no, that's the key part of this, right? Though is, and again, I think this is one of those changes, and I think healthcare obviously is driving this, and is at the a little bit more the pointy end of the stick of this for compared to everybody else. But those are the conversations. I used to be in another part of critical infrastructure, semiconductors, right? So again, same kind of thing. Had to go through that, but we had to talk through, like, are we doing due care, right? Like, it's not about passing the audit, it's due care. Am I doing what is standard care that everybody else should be doing within the industry or within the organization? So I think all of us within our different organizational silos, right? Industrial silos are starting to really go down that path, right? And say, but is it due care, right? Have I done what I'm supposed to do, at least by minimum? To that point, right? I think you guys have I love doctors and clinicians, don't get me wrong. But I do have a feeling they are somewhat like engineers, and we deal with engineers on our side. Probably, we don't have clinicians and doctors, but
Sure.
they always want everything, the new shiny objects, right? And they want to not technically follow a process because they want to get it now and they want to move forward. How do you and how has it changed over, the past 5 years or so? How has it changed in having those discussions from a CISO's point of view with those clinicians, engineers, in your organization? Because I know from my point of view, right, it's really about educating, right, and it's really about having that partnership and talking with them to understand what the risk is, right? So
Yep.
yes, the brand new SaaS application that you can swipe your corporate card and get the free, instance of, and we have all of those proliferating our organization, right? What's that risk? What's the risk of bringing in a new IoT device into a system and not following the specific, process to get that embedded and secure? How has that changed um, over the past, 5 years or so? And how do you see it? Where do you see it moving to?
So, I think I got a lot of thoughts on this, and I can go in a lot of different angles. First and foremost, there's the partnership between cyber and the business, of course, is very important. There's in healthcare, you've got your chief medical officer, your some of your go-to folks tend to be like your CMIO, your chief medical information officer, or they might be called a chief health information officer, chief clinical information officer, or other ones. These are folks that are both physicians and nurses and also informatics people. So they live in one foot in IT, one foot in care, and they lead these programs on how you actually deliver the clinical protocols to the clinicians. Those are very important relationships because they're going to speak your language and they're going to also educate you on sort of what's happening on the floor. Also, emergency management departments, very important uh, relationships, your clinical shared services departments, like your pharmacies, your labs, your imaging, and so forth. These are groups that are not the doctors that are seeing you, at the bedside, but they're running, they're running your labs, they're running your images, they're doing all these things. So it's important to know that, but it's also equally as important not to get away from what IT is doing. So because that is like it's hand in hand, so the best way I have seen all this run is when cyber and IT are in lockstep on governance and the business is on lockstep on governance. And it's a cultural expectation that as you bring things in, it comes in through a defined channel that everybody is saying, yep, that's the channel that it goes through. You can have your ideas, you can go to your conferences and see the whiz bang widget, whatever, and you can, bring it through the pipeline and let the machine work. And where cyber should attach is in those pipelines. And the new project comes in, new AI tool, comes in. That's the rage these days. And so so how do we define safe and effective use of AI? Cyber is one of the factors on that. Privacy is another factor. Clinical effectiveness is maybe even the most important factor in all of that. Is it hallucinating? Does it have biases? Can it actually provide good insights, for clinicians to use? And yeah, and then is it safe? Is the whole thing like it's like back in the days of when you put a drug in a body, it goes through all of these pathways, all these clinical trials and pathways to determine dosage and safety and efficacy. I don't see AI as any different than that, where you've got to have the sign off on all of those. And now you're adding cyber into the mix because the safety and efficacy of that can be disrupted through a new vehicle that was not there before. So we're just one of several checks, through the process. So when it's running great, that's what happens. You have it, you have good governance, you have all this kind of flowing through it. You've got your people, you're connected to supply chain, you're connected to legal, you're in the midst of the contracting, everything is in. So now we can go way too far to the extreme. And
Right.
this is where I think cyber in general has, and I think it goes back to the first comment that you made about who are those of us who get into cyber, like what makes us up? Like, why do we do this? Because let's be real, there's a lot of bruises and bumps and broken bones that we get.
Absolutely. Absolutely.
And you sign up for it. Like you're signing up to get like why? Like that question asked to you over and over and over and over again.
Exactly.
And very smart people debating your analysis. Like that's part of the job. So if left to their own devices, cyber practitioners, takes our job very seriously. And by the very way that we think, I have a little tagline that I say to people when they ask what I do. And, I used to say CISO, and they're like, I have no idea what that means. I said, okay, my tagline is I'm paid to be paranoid. That's
Right.
what I do.
Right. Exactly.
So take that to the end of the line. Like, we're paid to be paranoid. We can invent the scenario by which the thing will disrupt and blow up in our environment. If we have no guardrails, we will always come to that conclusion. We will what if our way into it. So there's and we're not going to talk about risk quantification or versus qualification. I actually have a whole, I'm very anti-quant because I just don't believe that we're smart enough. The actuaries are smart enough. I don't think we have the right data, and I don't think we have the right discipline to do it correctly. That's my only snippet there. But what we can say is, this is a line that I've been using, again, trying to keep it simple. Is the risk of this issue and the impact of this issue possible, or is it inevitable?
Right.
If it's inevitable, we're not playing around.
Right.
So what does inevitability look like? You've got a VPN system on the internet without two-factor authentication. You're going to get compromised. I'm guaranteeing you're going to get compromised. It's inevitable.
Maybe not today, but it's going to happen.
It's
Right.
probably already happened.
Right. Exactly. Well, you just don't know it happened.
You just don't know it. It's inevitable because
Right.
that's how the adversary, the credentials are compromised. They're sold on the dark. It's all over the place. Our identities are compromised all over the place. Inevitably, if you're just relying on a password, you're done.
Right.
If you have a known exploited vulnerability on the internet, a KEV, which is a specific vulnerability that's produced by CISA, and you don't fix it within 72 hours, you're in an inevitability land of getting popped.
Right.
So now, possibility. What can that mean? Now, if you've got multiple controls and maybe it's deep in the environment. I mean, you talked about IoT. I call IoT possibility in most cases. Because the pathway to get to it and what needs to be done to leverage it is very varied. And it's not the playbook that the actors are using today. Tomorrow they might, but today it's not really in the mix. So, our job is to understand the difference between those two and hold the line on inevitability. We have to hold the line on that. And then possibility, now you're in risk tolerance land, risk negotiation land, planning land, maybe not tomorrow, maybe a year from now, whatever that stuff is, put it in a risk register, call it, track it, monitor it, manage it. That's how you get through all of this and keep everybody happy and acknowledging that we see a problem, we see an issue, we're working the issue. I mean, clinicians in healthcare, we understand risk. This is, it's the equation of healthcare. Like, look at all the things that we do. We talk about risk all the time. When you go to a surgery, what's the risk of the outcome being successful? It's never 100%, so we can do that. Like, we understand how that works. But anyways, that's part of the way I think about the world, and hopefully that's helpful.
Well, I'm amazed that you can keep everybody happy, because I haven't learned how to
I
keep
don't know about
everybody
that.
happy yet. I don't always walk out of meetings with everybody being
No,
happy.
I don't. I don't. And trust me, it sounds like all rainbows and
No,
sunshine, but
I'm just joking. Just joking. So this has been amazing, Eric. I mean, it really has. What I want to ask you last is, what are the three like takeaways that you want somebody to take away from listening to this?
sure.
Because we have a broad audience, right? It's CISOs learning from CISOs. It's people wanting to, move up in the cybersecurity organizations, right, and understand this. It's CEOs, it's CIOs trying to understand the landscape in which they're working, right, and understand the risk. So, what three things do you think you would want them to take away from listening to this podcast today?
Yeah, I think first and foremost, it's we have to, as a cyber professional, we have to move away from just thinking about the world as information security, data security. I have secure data that I need to protect, and I'm going to protect it, no matter what, like kind of thing. And we have to shift towards adversarial mindset and adversarial thinking. Who are the adversaries that are coming after us? Why are they coming after us? And what are the methods that they use to come after us? What damage do they cause? Organized crime is the one that does ransomware attacks. The way organized crime works is they have a playbook that scales to every business in the world, and the methods that they use are the exact same across every single business. Like the difference is they have the scale to understand who we are and find those issues quickly and break in and break out fast. They're the fast game, and so and the highest disruption game to business, like business disruption. Nation state, totally different beast, totally different animal, totally different thing. You might not even have nation state interests come after your organization, depending upon what you do, or you might be the target of the nation state because of what you do. You're in the defense industry complex, you're a target,
Right.
and it's not the fast and furious, it's the low and slow, the real long game, the real slow long. And the way you defend against that is very, very different than how you defend against the ransomwares, activism, and so forth. So, anyways, understand the adversary, understand their methods, and build your defenses accordingly to how those adversaries operate. That's one. Um, Actually, that's two. The moving out of mindset of just thinking about the data side and then the adversary side. And then, three is what I would say is the the relationship. So how do you be a good CISO? It's you really have to have at the end of the day, the company is looking at you and saying, do I trust this person to be at the helm? Do they have are they applying reasonable measures of defense that is tailored to the what our business needs are and our growth strategies and our all of it? um, are they capable of making trade-off kinds of conversations and understanding dark red lines and then everything
Right.
else? And are they in this for your constituents, your customers, and your business or not?
Right.
That's what it is. I mean, yeah, we all come up from tech, likely,
Right.
So I came up from tech. And I can be a technologist, and if I just am a technologist, I can lose sight of everything I just said, and I can engineer our company into a box,
Right.
and that won't be a successful CISO. So we've got to be able to understand those nuances. We have to translate. We have to be able to bring those strategies back, press our teams to think differently and change, and partner with everybody else. So hopefully that answers it.
No, those were three
Yeah.
great takeaways. I mean, I have to say that, the key to this is, and I think that that's really, I think there's still some organizations in some areas that think the CISO has to be the end all be all technologist for the
Mhm.
organization. And yes, we have to know technology, but we have to understand the business much more so. And we have to know it across the entire organization, right? You have to understand what marketing is doing. You have to know what finance is doing. You have to know, like, we have to know everything, right? From a business point of view, so that we can help drive business enablement. And so that mindset, I think, is changing. It's changing much more rapidly than I've seen it in the past, but I think that you were spot on those. And so, Erik, thank you so much for
Sure.
jumping on and being part of this podcast. Really love the conversation, and thank you again.
You bet. Thank you.
Thank you, everybody, for joining us today on the CISO's Current, a CISO's Connect podcast. I look forward to seeing you on our next episode. Thank you.